Welcome to the Pulse Report. I'm Dr. Shen, a cardiologist specializing in electrophysiology and the Director of Research and Education at Cardiovascular Medicine. Welcome to today's Innovation Update. For people living with atrial fibrillation, or AFib, one of the biggest concerns is the risk of stroke. We usually treat that risk with blood thinners like Eliquis, Xarelto, or Warfarin. More recently, a device called the Watchman has given us another option, sealing off the small pouch in the heart where most clots develop. Now, an exciting international trial called LAAOS IV is asking an important question. What if we combine these two approaches, blood thinners plus the Watchman, for people at the highest risk of stroke? That brings us to the trial itself. Let's take a closer look at what LAAOS IV is really testing and how it's designed. This trial builds on earlier work published in the New England Journal of Medicine. It showed that surgically closing the left atrial appendage during open heart surgery on top of blood thinners reduced stroke risk by about 1/3 over 4 years. That was a big step forward, and LAAOS IV is now testing the same idea with a device-based approach using the Watchman. And here is how it is done. In terms of eligibility, this study is focused on people with AFib who are at very high stroke risk. Either they've already had a stroke or they have a high clinical score that tells us their risk is elevated. And there are two groups. One group continues blood thinners. The other group receives blood thinners plus a Watchman implant. Then comes the follow-up. About 4,000 patients worldwide will be tracked for up to 3 years. Researchers will be monitoring not just stroke and heart-related events, but also changes in memory and thinking, since AFib has been increasingly linked to dementia. So this study isn't only about preventing strokes. It's about understanding the full impact of treating AFib on both the heart and the brain. Now that we know what the trial looks like, the next question is, why does it matter? Why test this approach at all? It is because even when patients are on blood thinners, some still have stroke. In fact, studies show that in certain high-risk patients, the chance of stroke can be as high as 1 in 8 over just 2 years, even when they're taking their medication. Why does that happen? There are a few reasons. Sometimes blood thinners have to be interrupted for surgery. Sometimes people experience bleeding side effects that make it hard to continue, and sometimes the medicine simply isn't sufficient. The Watchman helps by physically closing off the small pouch in the heart where over 90% of clots form. Combining it with blood thinners could give patients an extra layer of protection, like putting both a seatbelt and an airbag in a car. So that's the reasoning. But what does that actually mean for patients who choose to join? Let's walk through what participation looks like. Patients are randomly assigned to one of the two groups. If you're in the Watchman group, the implant is done with a thin tube through a leg vein. It's a minimally invasive procedure, and patients typically are discharged on the same day. Both groups stay on blood thinners. Everyone in the study has regular follow-ups, imaging, and memory checks for up to 3 years. The goal isn't just to count strokes, but also to see if this approach helps protect brain health over time. Because we know strokes don't just affect movement, they can impact memory, independence, and quality of life. We've talked about the details of the trial and what it means for individual patients. But the story doesn't stop there. Let's zoom out and look at the bigger picture. This is truly a global partnership with hospitals across North America, Europe, and Asia, all working together to answer the same critical question. And I'm honored that our team here in the Quad Cities has been chosen to help pioneer the trial in the Midwest. By enrolling patients locally, we're not only giving people in our own community access to cutting-edge care, but also contributing to an international effort that will shape the way AFib and stroke prevention are managed worldwide. That's the real strength of LAAOS IV. The results won't just apply to one hospital, one region, or one type of patient. They'll be relevant to people everywhere. And health policy is already beginning to adapt. As shown in the Journal of the American College of Cardiology, early data and coding changes are paving the way to support combination approaches when evidence justifies them. If LAAOS IV confirms its hypothesis, Guidelines for AFib stroke prevention could shift globally. All of this brings us to the bottom line: what LAAOS 4 could mean for patients, for communities, and for the future of AFib care. LAAOS 4 is testing whether combining blood thinners with a Watchman implant provides stronger protection against stroke and memory decline for patients with AFib at the very highest risk, and it's being tested by a global team of researchers and patients. We're proud that here in the Quad Cities, our community is part of this international effort. If you or someone you love has AFib and a history of stroke or very high stroke risk, ask your cardiologist if participation might be an option. Thank you for listening to the Pulse Report. I'm Dr. Shen, and let's keep your heart and your life going strong and in rhythm.